here at your facility, you do a lot of different types of treatments to help people recover. And I don't think a lot of us really know what they are. One of them is IASTM. Tell us a little bit about what it is, how you do it, how it's helpful.
Perfect. Yeah, so IASTM, ASTM, Graston, there's a lot of different names from it. I think Graston was the original. They had just patented it. Patents up, everybody's got their kind of own thing now, but it's basically a use of a tool like this.
That looks like a torture device.
It pretty much is, and it kind of feels like that a little bit. The days of when Graston first came out, it was a lot of pushing, a lot of scraping, long durations. People would come out with giant bruises. Unfortunately, research has shown us that that's not necessary. So if you've had this before and you wanted to shy away from it, again, we don't really do it like that anymore. But there is more and more research coming out. And it's basically, IASTM is instrument-assisted soft tissue mobilization.
That's a mouthful.
Yeah, it is, right? That's why we say IASTM or ASTM or Graston or things like that. But with this tool, two things. Saves my hands. I want to practice long into my, for a number of years. But it's a lot easier on the patient. It has specific goals. I really like this for chronic long-term things. Somebody that's got a quad or a calf that just really won't go away, it won't loosen up. Because one thing this does is it helps not only break up adhesions, if we can, that's debatable, but we're getting blood flow there and a mild inflammatory response. Because we know that tight tissues need oxygenated blood, but if you damage a muscle, it doesn't just lay down in a nice contractible muscle again. It's this big blob of scar tissue and muscle and fascia and everything that's wrapped up in there. So our goal with this and what we think we're doing is scraping that out, trying to get that to a more uniform laid down tissue. But that inflammatory response comes in and helps that heal a little bit faster and kind of resets the healing process. So it's great on chronic type things. In the acute setting, it's good for just circulation. You can flush out a little inflammation, but sometimes this is just a little bit more comfortable than doing it manually. So it's just one of the tools that we have here in the office. But with like the running population, shoulders, any athletes really, the other thing that I like about this that works really well is we can go through a full range of motion. So if I've got a shoulder issue, you're just not sitting here and we're scraping. We're working through those pain points and actually scraping, and it's kind of what we call it, scraping. It sounds great, right? But we're able to do that through a full range of motion. And that's where the real benefit is as an athlete, we need that full range. We need as much muscle recruitment as we can get and stimulation so that we can be powerful, we can be explosive, and we can go on long duration events. And this helps us do that by regaining some range of motion.
Awesome. So there you have it. ASTM, great for chronic pain. And essentially, range of motion. We get a little inflammation response, which helps healing, get that blood flow in. If you haven't given it a try, make an appointment, see what Dr. Andrew can do for you.
Perfect.